Nurses care for people during a critical time and are a vital part of the healing process.
Absolutely, and an area program blends health and faith through a very special nursing program. Many patients and their families rely on their faith, and we're talking more about this in today's Faith in Our Community with Faith Roberts, Director of the Magnet and Professional Nursing Administration Program, and Jeannie Douglas, who's a geriatrics nurse for Carle. It's nice to have you both.
Thank you.
Let's talk about, we're talking specifically here about parish nurses. So what do they do, Faith?
As a member of a faith community, it's a way for he or she to take their gifts and talents as a registered nurse. It might be explaining medications to a church member or lab tests that maybe they don't understand, helping them understand their health a little bit more, how their body works, and through education and also, I would say, guidance through the healthcare system in this town. We help a lot of people who, at the beginning of the academic year, we get new members in our churches who may not know where to begin to find health care.
Well, and in this day and age, too, healthcare has gotten very complex. And so you've got a lot of, portals to navigate there. And that's part of where you guys help. And you blend, as we were talking about, both faith and health. So how does the faith connection come into the nurse's role? Is that something they're specially trained in?
Definitely the classes that we offer, prayer is part of the curriculum that we do, but as a member of that church, they already have relationships with those church members, and they're a trusted person for them, and so it's much easier to blend your faith and your own beliefs with someone who shares them with you at your own faith family.
Sure. Well, and nursing is all about, right, and correct me if I'm wrong, but it's about making sure that they know what's going on and making sure that they're comfortable. So this faith connection really does tie in, do you think?
Well, in nursing in general, we like to look at the whole person, and a person is just not a physical being. There is the psychological, emotional, spiritual side, and to get actual health, you need balance and health across all those areas. So,
yeah. As a geriatric nurse, are there needs that you guys fulfill for senior citizens that might be a little bit different, say, than for people of a younger generation?
I think that's very true, and obviously the baby boomers are aging.
Sure.
We're seeing a lot of people enter a life now, children taking care of parents instead of the way it used to be, and so we have the need for what's the next step in a safe place to live, loss of a spouse, dementia, all these things, and how do you guide people to help them make these right decisions for their family?
So Faith, why is it important for Carle to offer a service like this?
We have offered it since 1997, and we are proud of the fact that we have grown into the largest program in the United States.
Wow.
We have 490 parish nurses serving in their congregations in 33 counties. So
that's cool.
It's definitely a way for healthcare to have a presence in a different venue.
And there's an opportunity for people to learn how to become a parish nurse.
Absolutely.
So tell us a little bit about that.
We offer classes on the weekends because so many of the nurses who come take time from work to attend on Friday evenings and Saturdays, and it's over 3 weekends. They also receive continuing education credit for it. And Jeannie was in our very last class, and it was good.
So what was that like then, Jeannie?
I'm new at this.
Well, newish, but you've been through it and you've been working with people.
And I would say, actually, and I told Faith this during the class, it's the most affirming thing I think you can do, because if you have been in a church and people know you're a nurse, you're already being used as a parish nurse, because they're saying, hey, can I ask you about? And sometimes you're saying, I don't know, but what the class gave me was a phenomenal number of resources, not only books or handouts or a big binder full of resources, but a go-to person. When there's 490 of us, there's usually somebody who, by email or phone, we can get an answer for, so lots of resources. That's the most valuable piece, I think, of the class.
That's interesting.
Well, and there may be this idea out there that parish nurses are retired nurses, but that's not the case, right?
Some parish nurses might be, but we certainly embrace any age group of parish nurse who is interested in taking the class.
And I know we're getting the wrap sign here, but I want to ask, is it available to nurses of all, I guess, skill levels? Because you have multiple levels of nurses.
Absolutely it is, because you'll be working in your church. It is not something where you're going to be starting an IV or or some of the technical skills.
Well, wonderful. An opportunity to blend your faith with your work, which is fantastic. And as Jeannie was saying, it's so wonderful to build those bonds with patients.
Yeah,
So, yeah.
very
Well,
much.
thank you so much for telling us about this program.
Thank you.
So interesting. It's amazing when you explore faith in the community what you're going to find. Hey, if you'd like more information on what's happening over at Carle and the specific program on parish nurses, or if you want information about registering or getting squared away for those classes, we've got a link on our website at ciliving.tv, and we'll get you in touch. Thanks so much for being here.
Thank you.